Hi everyone. I haven't been making videos lately, particularly on my uh, DXing, because I haven't been listening to radio, and there have been a lot going in, my life, particularly on work front, and I've been busy attending to those. But meanwhile, I thought making this video would be necessary because recently I got myself diagnosed with ADHD, and I wanted to make this video to discuss my own experiences. Now I know that there are many videos available on YouTube which tells about their experiences on ADHD and the medication and how the medication transformed their life. So what I do have to offer in this video is that how I got myself diagnosed and how the medication has been working so far. So first of all, I wrote what I was supposed to discuss today about the physical effects of medication, the side effect, how it has affected my executive functioning, what are the expectations I have had and how to manage your expectation, and then conclusion. So first of all, I have had been struggling my whole life with, executive functioning and focusing. I mean, I have graduated. I have my diplomas. I'm working, but I've always had to put a lot of effort in terms of achieving what others would achieve easily, and these achievements are not the actual physical or abstract achievement in terms of the goals or objective, but in terms of the process or the method for those achievement. For example, attaining consistency in my work, motivating myself every day to do the things which I'm supposed to do, which will actually yield into my career growth, or making myself sit and study, or simply keeping my mind focused and not be weaving some daydreams just to get this good feeling. So these were my struggle, and since from the very childhood I have had this struggle, and I never understood truly why I have these struggle. I thought like this is just me, and everyone is different, and and then there are those who are able to sit and study and they are able to score well, and I can't do that. So I will just wake up a night before the examination and just do my studies and still manage to do what I'm supposed to do, graduate. But eventually started not to work when I started university, because you can't do that in the university. It's a long-term commitment where you have to consistently work, you have to consistently grow in terms of your skill, particularly your research skill, and it's not just merely passing examination, but it's more than that. And this is where I started to lag behind, and I could never truly understand what's wrong with me, that I, despite my intention to do things which I'm supposed to do, I couldn't. And then COVID-19 came, and things changed. It affected me badly, and post COVID-19 I have become worse, and my attention and my ability to commit to what I'm supposed to do, missing deadlines, procrastination, it all exacerbated. And this pushed me to see a psychiatrist, and they diagnosed me with general anxiety disorder because I was also getting panic attacks. However, I was not satisfied with the medication. I took it, and I was losing track of time. I was getting more sleepy. I wouldn't realize what I'm doing or where I am suddenly after waking up. This was something worse. So I stopped the medication and I stopped seeing the psychiatrist. Then 2 years later, I when I realized that I'm still struggling on my academic front, I reached for the psychiatrist again, and then they conducted this elaborate assessment, and it turned out that they diagnosed me with attention deficit hyperactivity disorder, commonly called as ADHD. And technically, I mean, they said it was like since childhood, but I never got diagnosed, so there's no scope for medication. And there was no improvement, and it just worsened over the period of time I grew up. And maybe COVID-19, it just affected as much as possible. So, what I would like to discuss today is my experience with the medication. I consulted the psychiatrist 3 months ago, then procrastinated on their further consultation, then procrastinated on taking the medication, but eventually I did last week. And it's been like today is like maybe so far I've taken 10 doses, but I haven't been consistent because I found like taking it every day was actually messing up with my sleep. So the medication dose which they gave me is this is the one which is it's the commonly called as methylphenidate, and it is 20 milligram. It's prolonged release, like prolonged over gets released over a period of time, and of course this is a very small dosage, and despite its small dosage, I still feel that it does more than what I'm required. So I'm not increasing any dose. Moreover, I don't take it every day. I take it on the days when I need after work. And I've mostly been taking it, during the morning, which is like early morning at 5. And about the physical effects of taking methylphenidate, which is commonly sold in market as Concerta or Ritalin internationally. Now, when I took it on the first day, I have had this sudden euphoric experience where I just felt very good, and I wanted to do what I have been procrastinating. I suddenly sat down, I wrote some portion of my work, the research work, which I have been procrastinating for a while. I cleaned my house immediately, and obviously, I called some of my, people, I usually don't call and talk to, and I don't like calling on telephone because I hate it. It makes me fidgety, and I get irritated calling or having conversation with people on phone. But I did, and I actually, became kind of very patient in my conversation, a little bit slower. So this was my first day. I felt pretty good, and it inspired me to take the medication on the second day as well. And I did, and for the next 3 days I did, and then I skipped because it was kind of messing up with my sleep. I usually don't have any issues with sleep, but then the medication kind of kept me awake at night. So to maintain that my healthy sleep of 8 hours, I skip on some days, and I realize that if I take on one day and I don't take it on the other day, the effect kind of remains on the other day as well. And so I'm not taking on every day, despite my psychiatrist asked me to take every day. So I'm missing the doses, and I know it is something, which I shouldn't be doing, but I feel like it is wise for me, based on my own experiences, not to take it every day. And and about the effect, so did it change miraculously my life within a week? Hell no. I mean, you might have seen videos of people where they discuss about that, how this medication would miraculously change your life. Yes, of course, it does allow me to focus, and I have been focusing on things which I'm doing or which I'm supposed to do, but it only helps you to have the focus. It doesn't make you do what you're expected to do. So if you are having this attention and focus, and if you are misdirecting it by doing something which you are not required to do or not supposed to do, for example, having mindless entertainment of watching YouTube or movies, how you are going to expect this miraculous change? It's not going to change your life dramatically. It only gives you, in my opinion, a better vision and clarity, but it doesn't give you a sudden change, an alteration to something which you have been doing for your lifetime, which is the selected bunch of bad habit which remained ingrained in your, the general lifestyle. So, in my opinion, the physical effect is first of all that it gives you the focus which you were lacking, but you will still have to redirect your mind to do things, the productive things which you would like to rely, for which you would like to rely on your attention. Just do it. And yes, it takes away some of the anxiety which I would have in starting a task. So if you would want to do those tasks, you start doing it without that, the fear and anxiety which earlier I would have. So that's a good thing. What about how long the focus lasts? For me, this is sustained relief. The psychiatrist told me that it may have the effect for 6 hours to 7 hours. For me, I personally felt the effect lasted for almost 10 hours, and the after effect is also there because that affects my sleeping cycle. Well, this is just a couple of weeks. And what about, the other feeling, for example, the side effects? Yes, it has the side effect. On the first day I took the medication, I got rashes on my tongue. I did not get the headache. I get dizzy. When I take the medication, I do get dizzy. There's this lightheadedness I feel, which means it kind of deters me from doing physical activity or driving, but it will not affect you to the extent that you will feel sleepy or inattentive. For me, I was able to be attentive, still like a bit dizzy, lightheaded. The other side effect, which is common and it happens every time I take the medication, is it dehydrates you. You will have dry mouth. You will have, it may not happen to you, but I do get dry mouth. I feel very thirsty. I drink a lot of water, and that's the side effect. And the focus is coming by way of stimulation. It's a stimulant, and this stimulation, it actually raises my heartbeat. My normal heart rate is 65 to 70 in resting, but after taking the medication for considerable amount of hours, let's say 2-3 hours, my heart rate goes 100, which I felt was a bit problematic. I don't get heavy breathing or this breathing difficulty, but yes, I got worried about the raised heart rate, and which I will inform my doctor in my next meeting. But yes, before starting the medication, my doctor did an elaborate testing. I had to get an echocardiogram. My heart condition was found normal. Then I also got an echocardiograph, ECG. My heart condition was normal there as well. Got myself tested. The blood work, CBC, complete counting of blood, and the liver profile test, kidney profile test, to see whether my kidney and liver are functioning normally. If you have either of these problems, then this medication would be very bad for you. So therefore, they have to do these tests to see whether you are in a healthy condition to take the medication. Now, it's a stimulant, so obviously it stimulates your heart rate, and I think that it in long term it does affect your heart, because there have been researchers which says that ADHD medication may cause cardiomyopathy, which is the weakening of heart muscle over a period of long time. Also, if you are taking more than the recommended dose. So this is something which has been bothering me about this medication. The effectiveness is good, but at the same time, the side effect is also there. And the researcher and the doctors, they usually say that the side effect should not actually, particularly in relation to, the heart condition, deter the practitioners from, prescribing the medication, because they say the risk is pretty low. But the research have shown that there is substantial risk of developing cardiomyopathy. So this is the part that bothered me. And this is what, it has given me a second thought, that would I want to continue with the medication, or should I go for cognitive behavioral therapy, which I feel that I am in a more need for cognitive behavioral therapy. And this is where I would discuss about executive functioning. Yes, the stimulant gives you that kick and drive to do things which you would want to do and with attention, but it doesn't give you, I mean, at least in my case, it doesn't change the way of life and habit which you have been doing or used to for decades. It will not suddenly make you a different person. You still will have to develop the discipline to act consistently. And this is what my experience is. I still lack that discipline to make myself choose the choice of doing things which I should be doing over things which I should not be doing. For example, I have developed the choice and discipline in relation to my eating habits. I eat very healthy, but my consistency or my discipline in terms of doing exercise is absolutely missing. That I will have to still work on. The same goes for my choice of not choosing mindless entertainment over, the things which I'm supposed to do. And that thing, again, I will have to fix because it has been there for a lifetime. And this will not happen suddenly because you started taking medication. This will happen when you will redirect the energy and the benefits of medication in the way towards bringing change and discipline in your life, which will eventually improve your overall quality of your life. There are some benefits of the medication which allows you to do so. One is that you have lesser anxiety, so you do socialize, and socializing is very important to to overcome the habit of lack of executive functioning, which I feel. It keeps you connected with the society, it keeps you connected with your peer group, you are more aware of your situational circumstances. It also helps you to think of the things what you are supposed to do in your life. So yes, the anxiety problem solved by the medication helps you in socializing, which is good. It improves your focus, which allows you to do your work with better attention, but you still have to discipline yourself to sit and work rather than find excuses and reason not to. The third one is that the third one is obviously the long habit, or the lifetime habit which you developed of procrastination and lacking consistency, that will have to be worked upon. Use the medication to keep that consistency, because medication does allow you to overcome the fear of not doing what you're supposed to do. So even if you're bored and you don't want to touch the work which you're supposed to do, for example, some of these skill activities of writing or reading, still do it, and that's fine. The medication will help you. But I personally did not feel that there will be some miraculous change in your life. For example, many stories I came across on YouTube or people sharing their experiences that the medication miraculously changed their life. I personally feel that don't have that expectation. You will have that expectation. It might upset you or disappoint you, because that's not how it's going to work. It will assist you, but that change has to come from your end by using the clarity the medication is providing to develop that consistency which lacked in your life throughout. Yeah, and it may happen that different medication will have different outcome, and so far I have only tried methylphenidate, and I don't know if this medication is the one which I have been looking for. In my next meeting with my psychiatrist, I may ask for a different one and see if that works for me. For example, there are some other amphetamine based medication, and I'll see if it works differently than this. But so far, I've found this medication as effective, but yes, it comes with a side effect, it comes with its own problem. So, like I said, you need to have your expectation managed, and you still need to do the work which you are supposed to do. Use the assistance of medication, but you will have to bring the change in your life. You cannot expect the medication to miraculously change the course of your life. The consistency, the discipline is still needed even after you have the medication. And this is why I believe that to take this cognitive behavioral therapy will assist you more than simply having the medication. So I think you should go for this if you are struggling at the front where you are lacking consistency and discipline along with ADHD. I hope that this experience helped some of you in figuring out what their situation is, and I look forward to your comment in the comment section. Thank you very much.